James McCauley. Thank you for downloading our resource guide, which helps marriage and family therapists working with military or veteran populations. So the resource guide I put together, it gives you a brief introduction in, I'm going to break down each section for you. It gives you a brief introduction as to the need for it and what we're seeing. It goes down to over 2 million service members have been deployed since September 11th of 2001. Lots of strains on the family, on the couple, maritally, relationally with partners. And this is something that we've seen growing as this cycle of deployments continues, where we're seeing more and more where there's a frequency of deployments overseas in support of Operation Iraqi Freedom and Operation Enduring Freedom. So I break down a list of each of the measures for you, and they're broken down in different categories. So there's PTSD and trauma, relational satisfaction, depression, substance abuse, moral injury, traumatic brain injury, suicidality. So with these measures, there's a few in each one. And what I liked about putting this together was thinking about what I would like in my office. I remember going back to my earlier days in grad school and hearing Dr. Gottman talk about the marriage clinic in the first book. And he was like, make copies of it, put it in your office, have it in your file cabinet so it's good to go. And I've always kind of built off that as I've grown clinically, and I hope that this is something that will help you. So with each category, with each section, there are certain measures there. And with each measure, I provide the name of the measure, some psychometric data, how you can use it in session. So is it something that we can use early on during the intake process? Is this something that we can give more than once and maybe implement it into some evidence-based care, treatment planning as well, analyzing the measure. So how do we figure out what's what with it? And what does a high score mean? What does a low score mean? What kind of scale is it on? Is it yes or no or on a Likert? And then a technique that may correspond with it that you can use. So if it's something like that you're going to use on an intake, say like the post-traumatic stress checklist, I've given that to both the service member or veteran and their spouse or partner and asked them to fill it out. And then I'll look at which clusters of symptoms that they both scored relatively similar with and tap into that with them. So it's a way of joining, processing the questioning, so tell me a little bit more about that. As we go along and we're working with them, if it's something that we're using in treatment planning, when it comes to that techniques, we can go back and we can look at, what's different now. What are the exceptions if we see a difference with the score? What's brought that on scale? What it may look like if they score a higher one? What would a lower one look like? Or if there were mostly 3s or 4s responded to it, and that was the top echelon, what would it look like if it was a 2? So you get that from the couple's perspective and the individual. So I provided each of those bullet points with each measure. And then we look at the application. How can we apply this guide? And it's kind of like I said early on, my hope is that you will see this guide and take this with you as just a tool to put in your toolbox that may help you serve those that are across the table or your office in a love seat or recliner or office chair, make them provide them with the best care possible. And these are some tools that you can do part of that with. So as well as our call to action, it's more of just a call to use more of that evidence-based research, practice-based evidence and measures to provide the best care that we can. We adhere as marriage and family therapists to our AA MFT code of ethics, if that's your association or your state or whichever one is higher as the more stringent ethical codes. That's what we subscribe to. That's what we prescribe to. So with this guide, if it strikes a passion in you for more, there's lots of other organizations out there that are providing CEUs and all sorts of stuff at conferences, statewide, national conferences, for you to continue to grow as a clinician serving this population. So thank you for downloading the guide. If you have any questions, you can get a hold of me. My contact information is on the guide itself. So thanks for your time and have a great day.